Good
Recording
afternoon.
in progress.
Good afternoon. This is Judy Costello. I work for the County Executive of Montgomery County, Mark Elbridge. On behalf of the County Executive and all of my hardworking colleagues in Montgomery County government, I want to welcome you to another Economic Revitalization and Recovery Town Hall. Today we have the pleasure of welcoming a guest, Anthony Featherstone, Executive Director of WorkSource Montgomery. And we have for your public health questions and information, Sean O'Donnell, who is the Emergency Preparedness Manager with HHS. I'd like to introduce our interpreter, Miriam. And before we move forward, she'll help us get set up for any of your multilingual needs. Miriam? If you need interpretation, you can find the access using the globe at the bottom of your screen next to the chat button. Okay, so today's another busy day for all of you and everyone here at the county. Quickly, a grant update. I'll give you a heads up that there are two grants that are coming to us from funds provided through the Maryland Department of Commerce. There's some paperwork and processing that has to be done, but keep your ears open to the business portal links that have already been shared in the chat. The first one is specifically for those who have been impacted by construction along the Purple Line in Montgomery County. And then again, pending council approval and some other processing, we expect that there'll be small grants available to those of you who have been affected in this way, probably beginning in November. Secondly, for businesses across Montgomery County, small retail businesses and restaurants who have been affected by COVID and can benefit from getting customers through online sales with a website or by promoting your products and services through online sales. The county government is partnering with Visit Montgomery to enable you to receive some grant funding to help you with your website and help you pay for telework capabilities so that you can promote your food, your clothing, whatever businesses you have through small business and online sales. This again has to go through county council appropriation and some other processing, but we expect that this funding, grants up to $4,000, will become available probably in November. Keep an eye out for the portal. Email us at the links in your chat if you have any questions. So those are two future grants to help you recover from COVID and deal with the impact of the Purple Line. But it's really exciting today to the WorkSource Montgomery has just announced a new grant that will help you if you've been impacted by COVID. It'll help pay for wages for you to onboard new hires. And without further ado, Anthony Featherstone from WorkSource Montgomery is here, and he can give you a high-level overview right now, and then we can take more questions on this after Mr. O'Donnell talks to us about public health. Anthony.
Sure, Judy, and thank you for the invite, and it's good to be here with you. As you mentioned, WorkSource Montgomery recently, on October 4th, this Monday, released our GROW grant program. And GROW stands for Grant Relief for Onboarding Workers, and it's a part of our COVID-19 relief endeavors. So what we want to do is we want to support our small and local businesses who have been affected by the COVID-19 pandemic in any way, shape, or form. Since its outset. We know that the pandemic has ravaged our hospitality industry, certain child care employers. We want to assist with the onboarding and ramping up process as folks begin to or continue to hire to try to get back to pre-pandemic levels. So as you mentioned, individuals will be able to go to our website, worksourcemontgomery.com, and apply for up to 8 new positions that they plan on hiring for to receive 50 to 75% wage reimbursements for the first 12 weeks for those new hires. So we're excited about this opportunity, and we're looking forward to receiving a good response and supporting a lot of our local businesses here in Montgomery County. Thank you.
Well, that's pretty amazing because you're saying that you will help reimburse up to 3 months of wages for up to 8 employees for businesses which have been negatively impacted by COVID, including childcare, restaurants, and others. And the place where folks can find that application, I believe, is on your website, www.worksourcemontgomery.com. Is that correct?
Yep, that's it. As soon as you go to our website, it'll be front and center on our homepage.
Awesome. Thank you. Well, I look forward to catching up with you in a couple minutes about some of the other programs and services you're offering. But right now, I'd like to introduce Sean O'Donnell. He is the key public health officer supporting all of us in Montgomery County, and I think he just got off some important phone calls and has some updates to share with us. Sean, welcome.
Thank you very much. If you're able to provide me with screen sharing, I'd be happy to show some of our data, which may make it a little easier for people to follow along.
Awesome. Ellen, can you help us with that, please?
Thank you very much. Okay, so I'd just like to give you, to start with, by giving you an update of where we are in the county with the latest dashboard information about positivity rates, transmission rates. Our test positivity rate, the average rate over the last 7 days, is now down to 1.74% of tests come back positive. We're pleased with that number. We are encouraged that this rate continues to come down. Having lower positivity means a low transmission rate. Our case rates have also come down slightly over the last few weeks. We are now at a daily rate of 10.12 cases per 100,000 residents. That remains the lowest rate in the state of Maryland. We are hoping that continues to trend down. We'd like to get down below 10, which would put us in the CDC classification of moderate transmission. We are still currently in the substantial transmission. At one point recently, it was ourselves, Montgomery County and Howard County, who were in that substantial range. We're now seeing some of the other counties in Maryland also move down into that. We hope all of these continue to trend down with lower transmissions.
It's good to see the declining curves and to know that Montgomery County is leading the state in terms of best numbers.
And, you know, there are likely a number of contributing factors to that. The social distancing policies, the masking policies, and the rates at which our county residents follow those are all, I think, very significant to contributing to that rates, as is obviously the rates at which our residents have gotten vaccinated. We are now at 98.6% of our eligible residents have received at least one dose of vaccination. You can see from this table, they've rounded that to 99%. 90% of our eligible populations are fully vaccinated. We have continued to see those tick up every week, and we're very encouraged by that. We still encourage people, if they haven't gotten their second dose, to go out and get it. Of course, that is of our 12 and above. We know that there's a lot of interest in the under 12 and when they'll be able to get vaccinated, and I'll talk about that in just a minute.
And we're still #1 in the country for any jurisdiction, 300,000 people or more in terms of the vaccination rate. That's awesome.
That is correct. And this is, again, it's a testament to our residents being interested in being vaccinated and coming out and going through with that, as well as so many partners across the county, both in the private sector and in the public sector, who have tried to make vaccine as accessible as possible. And case in point, this slide shows how many different partners have been part of this. A lot of pharmacies, grocery stores, and more recently, private providers have been getting people vaccinated. And as you can see from the upper right chart, you see back in May when vaccine we were first allowed to provide vaccine to our 12 to 15-year-olds. You can see those green bars and how they jumped. Very, very quickly, we had lots of people bring their children out to be vaccinated. We hope that repeats itself again when the authorization allows us to go to the 5 to 11-year-olds. So we anticipate there'll be a significant initial demand, and we have a couple additional partners that weren't even able to give vaccine at that time who can now give vaccine. So we're encouraged by that. Other news in this past week, we have seen, as we continue to see more and more people get vaccinated, we've seen the disparities between different ethnic groups continue to decrease. Our Black and African American residents are within 1 percentage point of the vaccination rates of our white non-Hispanic residents. Our Hispanic and Latino residents and our Asian and Pacific Islanders continue to have extremely high rates as well. Some people ask why these percentages on the left seem to be much lower than the overall vaccination rates. And there's two factors we just want to remind people. One is that 10% of individuals don't actually fill out the information on the racial or ethnic background. So that suppresses the total percentages we can track. The second is we get this data from the state Immunet resources. We know as a jurisdiction that borders the District of Columbia and is very close to Virginia, we have lots of residents who have gone to those other jurisdictions to get vaccinated, and they do not show up in this. So there's about 20% difference between the two charts just because of how the data presents itself. But we're encouraged by the ratios and the closure of those disparities. I'm going to, in the interest of time, I'm going to move through some of these a little bit more quickly. This pulse report is available through the county website, so we do encourage people, if they want to spend a little more time looking at the data, they can go to that website and get it. One thing I want to point out is amongst our population that is not fully vaccinated, and this does say 14% rather than 10%, because it includes, because of the way the data is provided, it includes 10 and above. We know our 10 and 11-year-olds have not been able to get vaccinated. But within the small number of eligible people who are not fully vaccinated, that 14%, they still make up more than half of our cases. They still make up 65% of our hospitalization rates. So those unvaccinated folks, even though it's a small percentage, are still at a much higher risk for contracting COVID or having serious effects for COVID. So we still recommend, even as we go into boosters and as we go into pediatric groups, we still strongly recommend that if you haven't gotten both doses of a Pfizer or Moderna vaccine or one dose of Johnson & Johnson, that you come out and get it. We continue to do across the county testing at county sites, at private sites, between the county and private providers. There's more than 40,000 tests that are usually done each week. And we continue to see vaccinations occurring at all different types of providers across the county. Again, I think most people are aware now that people who received a full course of Pfizer, 2 doses of Pfizer, and it's been at least 6 months since their second dose, can receive a booster shot if they fall into one of these categories. Essentially, we're recommending that any Marylanders who live in long-term care settings, if they're over 18, can get a booster if it's been 6 months. Individuals over 65 or those from 50 to 64 with underlying medical conditions are also recommended to get a booster after 6 months since their second dose. Other groups that can also get boosters include those from 18 to 49 with underlying medical conditions, or those who work in an occupation with increased risk. Those are the same categories as the initial priority of vaccine rollout. And I won't go through all of them. There's a lot. They are available on our website, on the CDC's website. But again, they include those underlying medical conditions and those occupations that were at increased risk when we first rolled out the vaccine. We've been advised not to change someone's course. If they were receiving Moderna, they should wait for a Moderna booster. If they were getting Pfizer, they should wait for a Pfizer booster. They're welcome to come to any of our sites. We don't ask for documentation on their place of work or their underlying medical condition. They just have to affirm that they fit one of those categories. And I know a lot of people are asking, well, what about the Moderna? What about the Johnson & Johnson vaccinated? Our information is that the FDA will be meeting in about a week or so to discuss the Moderna data, to discuss the Johnson & Johnson data. We're hoping that they recommend that they are authorized for boosters. And after that FDA recommendation, if you followed the news, you know that the ACIP and CDC teams evaluate it, and then they provide very specific guidance to state and local health departments, private providers of who can get it, when they should get it, how much they should get. I know right now they're considering a different dosage for the booster for Moderna. So that'll be the type of information we'll get. But we expect if that's approved by the FDA, it will happen very quickly when we can start giving boosters for those. As far as where people can go for boosters, there's a lot of places available now. I know back during the first and second shots, there was more of a limit of who had vaccine. Now there's hundreds of places across Montgomery County. We actually counted out more than 217 who are currently listed with the state site as giving vaccine. So we encourage people to go wherever they have the type of vaccine you need for your booster, to try to reduce waits in line, reduce waits for an available appointment. We do take up walk-ups at our county sites, but we encourage appointments to try to get people through as quickly as possible. And then with the timeline for pediatric vaccinations, there's a lot of interest in this. Again, the date we've been told is the FDA will be reviewing the data on October 26th. If they make a recommendation, then the CDC and the ACIP, again, will review and offer guidance on this. Obviously, this is a little bit more challenging because we're talking about populations that range quite a bit in size, from very small 5-year-olds up to much larger 11-year-olds. And I'm sure our federal partners want to make sure the guidance works for all of these age ranges. What we have been told is that there will be a different rollout of vaccine from Pfizer. This will be shipped in smaller quantities, which should accommodate private providers who have maybe more limited clientele. But it'll also be a different formulary, a different dosage. And we'll wait for that rollout to happen. We do anticipate it will be fairly quickly after the authorization occurs. So we're looking realistically, hopefully, perhaps the first week of November, or possibly a little bit sooner than that, where we'll have a supply of vaccine and authorization to give it. We believe in the county we have between 95,000 to 105,000 residents who are within that age range. And we're working with lots of our partners on different strategies to get this out. Obviously, we know that pharmacies and hospitals and grocery stores have been a very large part of getting vaccine out to date. We believe they'll still be part of this, and it will still be an option. Obviously, there's quite a lot of those across our county, which can make it a lot more convenient. But what we've looked at also is primary care providers and pediatricians now have the availability to give out vaccine. And what we've seen when we've talked to our state partners is that the majority of pediatric practices have already begun giving out vaccine to minors, and a number of family practices have as well. So we're going to continue to work with those to, again, make sure that vaccine is accessible as possible to our community. And so that was all of the information I have right now on the pediatric rollout and the booster shots. But when there's an opportunity, I'm happy to answer questions our partners may have on these.
Thank you, Sean. What a wealth of information. I would encourage anybody in the audience who has a question related to this presentation or anything else to share it by chat, and we'll make sure you have you have the opportunity to have your questions answered. I think we should congratulate all the Montgomery County residents who have been vaccinated and contributed to the high percentage vaccination rate, the lower case rate and lower test rate than other jurisdictions across the country, and give a special thank you, Sean, to you, Dr. Stoddard, all your colleagues, and our community partners who are helping with the distribution of the vaccines and are preparing and helping with booster rollout and the future rollout of the pediatric vaccine. So thank you, everybody. One question that's come up a couple times is now, should you get a flu shot? Can you get the flu shot at the same time as the COVID vaccine? And what would you recommend?
Yes, we did get clarification that you are authorized to administer both flu shots and COVID shots on the same day. So if you are going to see your provider and they have both of those, you can certainly ask for both of them, and it's certainly a good use of your time. I will share that the county does not have a huge amount of flu vaccine available to give out at our county sites. We'll mostly focus on COVID vaccinations at those sites. We do run a couple specialty clinics with flu shots for children and for adults. Some of that information, I believe, is actually being released today through our PIL.
Okay, good. And anecdotally, most of us have seen signs for flu shots at the grocery store and the drugstore. So if you want a flu shot, I have a feeling if you live in Montgomery County, you can get one way or the other. Thank you for your time. Appreciate your expertise. If you're able to stay on a little bit with us, if we have any questions for you, we will, in fact, we'll follow up with you. If anybody has any questions, just send them by chat. And thanks again, Sean. Right now, I'd like to reintroduce Anthony Featherstone, Executive Director of WorkSource Montgomery, to talk about his programs and how they can help you if you're an employer or an employee. Anthony, welcome back. You're at WorkSource Montgomery. I guess first, could you tell us a little bit about WorkSource Montgomery and what is the primary mission of your organization?
Sure. WorkSource Montgomery is the operator of the county's American Job Centers. And we work with the two customers that you just mentioned, Judy, our business community as well as our job seekers, and we try to make the match. So with our job seekers, we help develop career plans, which include upskilling or occupational skills training, and help them out with placement into our in-demand industries or whatever industry or occupation that they want to get into or they desire. And on the flip side, we work with our local employers to help them connect to that talent pipeline so that they can fill the jobs that they have open today and the jobs that they have coming down the pike tomorrow.
So you're basically a broker between employee and employer, and you're helping job seekers find jobs and employers find the help that they need. How specifically do you help a job seeker? I've lost my job during COVID. I heard about WorkSource Montgomery. How do I get in contact with you, and what can you do to help me?
Sure, that's a great question. So I'm excited to announce that our comprehensive center in Wheaton is fully open to the public now. So if you are a job seeker and you need help with finding employment or tapping into a training program, then you can walk into our physical doors Monday through Friday from 8:30 to 5 and get assistance. There's a few different ways that we help job seekers out. Number one, we have a core level of services that are available to any Montgomery County resident. If you want to come in our center and use any of our technology, from using our computers and internet access to do your job searches, if you need to print some things out or whatever the case may be, you can just drop in and take advantage of job fairs, technology, professional development workshops, and things of that nature. But for our job seekers that need additional assistance to get into their career pathway, we do offer programs where we pay for training. And we assigned individuals to a case manager that will walk with them hand in hand, shoulder to shoulder, to help them figure out what training program is best for them, figure out what training provider is best for them, provide barrier remediation and support services along the way so that they can focus on the training as opposed to personal infrastructure, gaps in child care and transportation and things of that nature. And then once training is complete, with all costs paid for by WorkSource Montgomery through our federal Workforce Innovation and Opportunity Act program, then we have a full complement of business service representatives that are out and about in the community interfacing with employers to make sure that we're able to make the match between the job seeker who's gone through our program, finished training, and is ready to get into whatever job they sought after when they walk through our doors. So there's varying levels of services, but we say it starts with a conversation because the services look different for each individual because everybody's different as far as what they bring with them when they come in the doors and what they want to do as far as their employment path. So we start with that conversation and then we build that customized plan, customer or job seeker by job seeker.
So well, you shared a lot of information. I'm going to ask you a couple questions about it. First of all, if I walk to Wheaton, is that at the new building on Reedy, or where is your office in Wheaton?
So our office is located at 11510 Georgia Avenue. It's not far from the metro station. We also have a center in Germantown. It's not open at the moment. It's in the Up County Regional Services Center, but we expect to reopen those physical doors in late fall or late in 2021 this year. And once we have an official date, we'll make sure that we share that publicly so folks know when we're open. But that's where our comprehensive center is located at 11510 Georgia Avenue. And within that space is not just WorkSource Montgomery. We have partners with the Maryland Department of Labor, Department of Rehabilitation Services, and a variety of agencies that offer different services so that we can truly make it a one-stop shop. So no matter what you want as it pertains to workforce development or maybe human services and benefits, you should be able to get it all done within that one-stop center that's located in Wheaton.
So if I'm looking for a job, but I'm having a hard time, it's hard for me to get to Wheaton, do you offer the services? Maybe I live in Up County, East County. Do you offer these services online?
Absolutely. I think that's one thing that the pandemic taught us is that virtual services have a wider reach, and that remote or virtual services will not go away for WorkSource Montgomery. So if you are looking for services and you are in a part of the county where logistically coming to Wheaton just doesn't make sense for you, then you can go to our website and connect with us through a contact form or just calling our general number, and we'll have one of our reps kind of walk you through our service menu and how you can connect to all the services that you can get in person virtually.
That's awesome. What if English is not my first language? How can you help me?
Sure. So we have partners who specialize with customers who have limited English proficiency. We also utilize the language line. Our website is available in, I think, more than 10 languages. And then we have a very diverse staff. I think our staff members speak about 6 languages. So we are able to offer certain services in multiple languages. So if you do have limited English proficiency, then we still want you to connect with us. And we'll connect you with our partners and serve you in the best way that we can.
That's great. You mentioned if I'm looking for a job, you can help with training, but what does that mean? Is that training on how to get a job? Is it computer training? What types of training can you offer me?
So there are a variety of levels of training, and everything really depends on the job seeker and what they need to get to the next step. So we have professional development training where we work on those soft skills. We help people with resume preparation, how to interview and communication skills, time management, and so on. But we know that some folks may want to get upskilled to crosswalk into other industries or to further develop their career path. And with that, we work with several approved training providers throughout the county and state of Maryland and nationally as well to offer occupational skills trainings. Montgomery College, of course, being one of our main partners. So if someone wanted to get their CDL, or if they wanted to enroll in some nursing courses, or obtain their Network Plus or A Plus certifications, then we work with training partners across our county and region and state to make sure that folks can tap into those programs and get those credentials to help take them to the next step.
Well, it sounds as if the training is a lot of different types and crosses different sectors. I know you also were involved with, you mentioned Montgomery College with their bio boot camp recently. What about, you talked about case management, childcare. Are you telling me if I'm looking for a job and I want to speak with one of your representatives or interview or get help on my resume, that you can help me with childcare too?
Well, one of the things that we offer in our WIOA program, that Workforce Innovation and Opportunity Act program that I spoke about, is intensive case management. And we know that having a solid personal infrastructure will allow our customers to focus wholly on their training and whatever activities that they engage in with their case manager. And a part of that support service offering could be assistance with childcare. Most times it looks like transportation assistance, whether it's a gas card or a bus card or whatnot. We also often pay for fees and licenses and uniforms associated with training and employment. So there's a variety of different ways we can help our customers out once they're engaged in training and our activities in our WIOA program, where we really sit down and do that in-depth assessment to figure out where the gaps are and how we can fill those gaps to meet their individual needs.
So what if you talked about how you can help me if I'm unemployed. What if I'm making a little bit of money, I'm working part-time, but this isn't where I want to be. Are you able to help me if I'm earning some income?
Absolutely. So our services are available to all Montgomery County residents, specifically unemployed and underemployed residents. And we would classify that person in that situation as an underemployed individual, and our services will look the exact same. We would do that customized assessment and figure out what your next steps are. So if you are in that situation, connect with us virtually, walk through our doors, whatever's best for you. We'll be here to help you out.
That's good to know. So we've spent a lot of time talking about job seekers. What if I'm an employer and I just can't find help? They're for hire signs, and we're hiring signs all over the county. How do you help employers find the great employees that we know might be out there?
So the approach is similar. We treat every employer partner as an individual and develop a customized plan for their individual needs. But our business service menu, offers a variety of services to our employer partners. We offer up our space if you needed to do a job fair or conduct interviews. We coordinate many or large recruitment events. We do screening and direct referrals of candidates that are in our workforce system pipeline. We also have subsidy programs that work well for our employers. Also, if you want to bring an intern on to kind of try them out for a position to see how they mesh with your team and your company culture, we're able to utilize our WEX or work experience program to pay the wages, take on the liability that comes with bringing them on board, so that you can try them out on the job, and hopefully at the end of that 4 to 6 week period, they have done a great job to a point that you want to hire them full-time as one of your, W-2 employees. There are also on-the-job training programs where if you do hire somebody through our workforce system, we're able to provide a reimbursement of 50 to 75%, similar to GROW, of their wages for a certain period of time based on the complexity and skill level required for the position. So it's a subsidy that helps the employer's bottom line with the training process to hire through our workforce system. And whether you just need access to screening, or whether you'd like to take advantage of our subsidy program, or anything in between, our business services representatives will work with them like we work with our job seekers to figure out what's the best plan of action for each and every employer.
And is that for any type of employer, a restaurant, an accounting firm, an auto shop? That some of these wage reimbursements and paid internship opportunities paid by your partners, are they available across industry sectors?
Yes, it's available across industry sectors, whether you're a construction employer or an IT employer, transportation, doesn't matter the industry. You can engage with us and we'll figure out what's the best plan of action for you.
Is there any problem if I'm an employer and I say, wow, that's great. You can help me find an employee and you can help me by paying some of the wages for me to onboard the employee or try to see if he or she will work for me as an intern. What if they don't work out? Will I owe you any money back? How does that process work?
No, we never ask for money back. These are our federal and county funds that we use to administer our programs to provide support. And for instance, if we do a work experience where we take on the liability and we pay the wage and you provide the platform to get experience for that individual, there's no obligation to hire them. Of course, that's the primary goal is to have them employed full time at the end of that rainbow. But we understand that every placement may not be a perfect fit, and if it's not, there's no obligation to hire or we won't try to recoup any of those funds. What we hope will happen is that in 4 to 6 weeks, if it doesn't work, that job seeker will have 4 to 6 weeks more work experience. They will hopefully have built a bigger network for references and so on. And they'll be in overall a better place at the conclusion of that work experience than they were going into it. So I think to sum it up, we never ask for money back. And we know that every placement is not, going to be perfect. But what we like to do is we like to recalibrate and evaluate what the gaps were so that the next time around, we maybe can pre-screen or do a little better job on our end than we did the first time as far as making the match for the employer.
But it sounds as if the risk to the employer, if you're an employer and you're looking to hire and you have that in your budget and someone will help you pay for the first month or 6 weeks, it sounds as if there's almost no reason not to reach out to worksourcemontgomery.com and try to find that perfect employee. What about COVID? You talk about the GROW program and COVID relief. What else are you working on that's specifically geared towards helping the many folks negatively impacted by COVID?
So there's the GROW program that we discussed to help employers out who've been affected by COVID. And we have a lot of other initiatives going on. We have a community impact team that's doing an outstanding job at connecting with our faith and community-based network here in Montgomery County. And we are expanding our model, a model of where we sit in our American Job Centers and wait for job seekers to come to us. We are taking our services to the community. And that's what our community impact team does. They go out in the community and they market services and awareness of what WorkSource Montgomery and our partners offer and how to attach to those services. And within the early to mid 2022, we will be able to deploy our mobile job center. So we'll have a mobile job center that's driving around the county, helping folks sign up for services and do different classes in the community and so on. So yeah, I think that's a huge initiative when it comes to recovery, is that we want to go out and find and work with folks in their communities where they're comfortable at, instead of just telling everybody to come to us. So there's a lot of activities going on, but I won't take up too much time with my response. But I think community impact is a very important initiative that we have going on right now, giving information to the community, but also bringing it back, bringing information back so we can identify service gaps and improvements.
Well, that's cool. It sounds like by next year, you'll literally be taking your programs on the road with a mobile job center. When you mentioned the Up County office, you're hoping that that'll be open by next spring for sure. Or will there be other physical locations besides Wheaton and Up County?
So Up County will open late 2021. Our mobile job center will be deployed probably at some point early to mid-spring. Right now, we do have our job center in the correctional facility, which is getting ready to open in the next few months as well. It's not a walk-in center, but it's a center where we help prepare our soon-to-be returning citizens on how to attach to the labor market. So we are, always exploring how to cut down on the logistical issues as far as how job seekers can navigate and get to our centers. So we're looking to expand. We right now don't have any concrete plans, but we think that the mobile job center will allow us to be exactly what it is, a mobile job center. So we can make sure that we are at different places and in different pockets of the community 365 days a year. So we're looking forward to that.
So we have a question in the chat. I know you mentioned multilingual, and you're talking about being able to take the mobile job center next year to different communities. But specifically from Luis, he wants to know if you could talk a little bit about the Montgomery County government jobs workforce opportunities for the Latino community, and maybe what you're doing in that regard. Yep.
So we do. So each month we publish a workshop calendar that's publicly available on our website, and I know our instructional coordinators. They offer several workshops each month on how to prepare for government jobs. So I would encourage job seekers that are looking to get into to public sector employment to go to our website and engage in those workshops that will teach the nuances of how to develop your resume, how to interview, and how to adequately position yourself competitively to get those public positions. We're also, always, working with local employers, which includes Montgomery County government. So, we're making connections with the Department of Human Resources with Montgomery County government to figure out where the opportunities are, so we can align our programming to hopefully get some of our job seekers into those open opportunities with the county. So I would say first it would start with engaging in our public sector preparedness workshops with our instructional coordinators.
It's a little bit hard in this format to make sure we're having the question right. I think he may be looking at your assistance to specifically in the Latino community to help with increase job opportunities or make those matches that you've talked about earlier on between employer and employee.
Yeah, so we're doing a few things. I think number one, like I said, we do a customized approach for each individual job seeker. So I think with those workshops for our Latino residents, we offer all of our workshops in English and Spanish. So I think that's number one that I would like to mention, is that we do have a bilingual and instructional staff. And I would say to engage with us and let's talk about your individual goals. And we'll connect you with one of our business solutions representatives that can kind of help you individually on your career path. So I would say it starts with that individual conversation and engaging with a career advisor or business services person to figure out, what your goals are and how we can help you get there. And we have those business services reps that are working, shoulder to shoulder with our job seekers to get into county government jobs or to get into private sector jobs or whatever the case may be. So I would say that we don't have a specific initiative, but those job seekers from the Latino community and any community can come in and engage with us, and we'll try to place you in whatever sector that you want to get into.
So, Louisa, it sounds like the next step is may not be a workshop for you, but having a meeting with the business solutions representative at worksourcemontgomery.com. I understand from your chat you're a little bit frustrated with the number of applications you've sent out and the job opportunities you have. If you haven't yet met with anybody at worksourcemontgomery.com, I think I would encourage you to do that and follow up with us afterwards and follow up with Anthony. Let us know how it is. So this says a comment that I think some people wonder, are you a recruiting firm? You're not, the way you've described it, you're not really like a private sector recruiter. because of your mission, your funding, and your matchmaking. Am I correct with that? How would you describe the difference between WorkSource Montgomery and a typical recruiting firm?
So I think number one, we don't charge for our services. All our services are publicly funded, so there's no fee for our recruiting services from the employer side of the house. And on the job seeker side, we focus, I think, a lot more on upskilling. So it's not just an assessment and placement. It could include a variety of different routes. And one of those majority routes that we see is training. So we do a lot of upskilling through individual training accounts with our job seekers. So I think those are the two biggest differences is that number one, we don't charge employers for any of our services, although the services are similar. And on the job seeker side, we have the ability to help folks get into credential programs and gain certain certificates to make them more marketable in the job place. And then I think lastly, just case management. We offer intensive barrier remediation and wraparound support from a case management standpoint to make sure that we can alleviate some of those barriers to employment while you're working through our services.
So, Luis, and anybody else, if you've not, I can't tell from the chat, but it looks to me as if you might not yet have had the opportunity to meet with someone from WorkSource Montgomery. If you would reach out and do that and see if you can get some of the assistance that Anthony describes. They tell us about your track record. How do we know that the wraparound services, the training, and the matchmaking that you described, Anthony, works?
So I think first, I can't see the chat right now, but I would advise Luis to do exactly like you said and connect with us and give us feedback on the services or how effective he believes our services are in finding employment. And I'd also offer myself up on this meeting to have a conversation with Luis if he's not satisfied with our ability to help him out with placement. Because that's what a job center is for. It's to help people find jobs. So, Luis, please engage with us and please let us know your feedback, good or bad, so that we can figure out how to course correct if we need to, or how to maybe change up our approach to help you find employment. And that's for any job seeker in Montgomery County. As far as how do we know that our services work? We of course have our quantitative feedback that we receive from the Maryland Department of Labor on how we're doing and helping people find jobs, finish training, and retain those jobs. And we also like to do surveys with folks who engage with our system to figure out what's their firsthand feedback from a customer service standpoint, from a value add standpoint, as far as us being able to direct you. And help you out with your career path and connect you to different resources, employers, and tools. So those are our main two mediums of feedback. And then we also have our community impact team. So we want that honest and transparent and feedback on how we're doing. And we want to come to the community and get that feedback as well. So there's a variety of different ways that we get feedback and engage on how our services are working. And those are just a few. And we also use data. In addition to the Maryland DOL's reports, we look at demographical data because we know that certain demographics are more affected by the COVID-19 pandemic and are under-resourced and so on. So we make sure that we look at the data to determine if our services are offered in an equitable manner and if we need to course correct and so on. So there's a few different ways we see if it works, but we like to get that anecdotal feedback from each and every customer and literally at each and every touch point on how they perceive their services when they work with our staff.
Well, many recruiters do seek feedback, but they don't all look for feedback pro and con. And so we have heard lots of good things about WorkSource Montgomery. We know that it's a tough job market and there may always be room for improvement for all of us. But I see that Lewis is going to be calling you on Monday morning, and we would encourage any job seeker to reach out through WorkSource Montgomery, and for any of you, whether it's grants, jobs, public health issues. We've put in the chat the address for the Biz Portal email and the Biz Portal website and WorkSource Montgomery's website. And all of us, I think I can speak for those of us on this call, we're here working for you as your public servants. So we want to help you if we can, and we encourage you to reach out to us by email so we can follow up. I know it's about time to wrap up here. Let me see if there are any other questions for Sean. Sean, thank you for staying on. Anthony, thank you for taking the time to explain more about your services. Again, that grant program that you let us off with is exciting. Quickly, you can say it again. It's what, 12 weeks of onboard wage partial reimbursement for up to 8 new hires of a company, or correct?
Yep, Judy, you got it down pat. 50 to 75% wage reimbursement if for the first 12 weeks if you've been affected in any way, shape, or form by the pandemic. So go to our website, fill out an application, and we'll look forward to receiving it, reviewing it, and getting back to everybody promptly. But Judy, I want to thank you for having me on. This has been a great conversation. I really appreciate it.
Well, thank you for being here. One other thing, I know you and I talked before, and we're about out of time, so instead of asking the question, I'll just say most of your services are available not only to private sector companies, large and small, but also to nonprofit organizations. And similarly, if you're a job seeker and you want to work in a nonprofit, Anthony's team at WorkSource Montgomery can help you. So thank you again, Anthony. Thank you, Miriam, for interpreting. Thank you, Sean, for all the hard work you're doing to keep us healthy and safe. And thank you, Ellen, for organizing us. And our next town hall will take place in 2 weeks. Miriam, gracias. Our next town hall will take place in 2 weeks with the topic to be announced soon. Thank you all. Happy Friday. Have a good weekend. Stay safe.
Está accesible realmente. So, lo único que realmente pedimos es una foto de identificación y prueba de domicilio.
¿Qué más podemos encontrar para aquellos que tal vez nunca han visitado una biblioteca pública? Danos un recorrido de qué podemos encontrar ahí.
Ok, haré lo posible.
Tenemos, porque hay mucho, pero danos un breve abrebocas de lo que podemos